Hello, my name is Chastity Cook. I am a veterinary technology student at Hillsborough Community College, and today I'm going to talk a little bit about first aid for our animals. Just a little disclaimer that anything that you do for first aid for your pet should never be considered a replacement for any proper treatment. So before you put your veterinary first aid kit together, you want to make a list of phone numbers that you might need in case of an emergency. The first number to have on hand is your veterinarian. It's also a good idea to do a little research and find out what the closest 24-hour emergency hospital is. This is something you certainly don't want to have to take the time to do during an actual emergency when time is of the essence. Have the name of the clinic where they are located and their phone number on the list. Another important number to have on this list is the number for the Animal Poison Control Center, which you'll see that later on in the slideshow in case you need to write that down. If your pet gets into something that can potentially be toxic, then you're going to want to give the Animal Poison Control Center a call, and they can instruct you on what to do based on, what the animal might have ingested. You can keep this list of numbers on your refrigerator or keep a copy of it in the kit itself, basically anywhere that you're going to have quick access to it in case you need it. The supplies you're going to want for your first aid kit will have the typical first aid items that you would have in a kit for the human members of your family. Things like gauze, bandages, adhesive tape. Some other things that you will want to have in the kit is some milk of magnesia, some hydrogen peroxide, which is good to induce vomiting if they get into something that you want, them to bring back up. Also a digital thermometer, an eyedropper, a muzzle, and a leash. So once you have the kit all together, you can store it in a place that you'll be able to get to it pretty easily. That way you're not frantically searching around for it if you need it. So some things to keep in mind when dealing with a sick or injured animal is to always remember that animals in distress are very likely to bite. They don't understand that you are trying to help them, and if you aren't careful, you can end up injured as well. This is the reason I mentioned having a muzzle in your first aid kit. The next thing to remember is to try to stabilize the injuries before you move the animal. Then, when it's necessary to move the animal, keep it confined to a carrier or a box. This will reduce the risk of further injury. If you have a large breed dog, you can use a board, a blanket, or basically anything that will work as a stretcher. So now I'm going to talk about some actual first aid procedures. Okay, so I think most of us know what the obvious toxins are in the house. However, there are some other things that might not be quite as obvious. It's a good idea to educate yourself on what plants and foods are toxic to our pets. The American Veterinary Medical Association website has a great downloadable brochure that lists some of these common items. Also, if your pet has ingested something that comes in a package or has a label on it, you're going to want to read it because sometimes there can be some pretty good information on what to do in case of ingestion of whatever that product is. So for seizures, if your pet has a seizure, the first thing you want to do is make sure that there aren't any objects around that could injure them. You also don't want to attempt to restrain an animal while it's having a seizure because that could cause injury to the animal. Be sure to time the seizure because you're going to want to relay this information to the veterinarian. Once the seizure is passed, keep the animal as calm and quiet as possible and then contact the veterinarian or 24-hour emergency clinic. Alright, so if you're dealing with a fracture, the first thing you want to do is muzzle the animal if possible. Fractures are extremely painful and the animal is likely to bite while you are handling and transporting. Unless you have experience and know what you're doing, don't attempt to set the fracture. This can cause more harm than good. If you're unsure, then it's best to leave it for a veterinarian. When it comes time to transport the animal, do try to secure them to a board or stretcher. And then, of course, as always, seek medical attention immediately. In cases of bleeding, we need to know what type of bleeding is going on. Is it internal or is it external? If it is external bleeding, the important thing to do is to apply and maintain pressure and get the animal some medical attention as soon as possible. In cases of internal bleeding, then you're going to want to make sure that you can recognize the symptoms such as bleeding from the nose, mouth, rectum, coughing up blood, blood and urine, pale gums, collapse, and a weak and rapid pulse. Keep the animal warm and quiet until medical care is available. So if you're dealing with burns, you always want to try and muzzle the animal. Then you're going to need to apply a cool water compress to the burned area unless you are dealing with a chemical burn, in which case you want to immediately flush the affected area thoroughly with water. Okay, so I put this little chart on the side over here because I wanted to stress how important it is not to ever leave your pet in a car. As you can see, even cooler, mild temperatures outside can increase to dangerous levels inside a car. Even with the windows cracked. Especially here in Florida, it can become a problem very quickly. Every year, hundreds of pets die this way. This leads me to my next problem, which is heat stroke. The first thing you're going to want to do is move the animal out of the sun and heat into a cooler shaded area. Use a towel that has been moistened with tepid water and then place it on the groin area, the abdomen, or the area under the arms, which on us would be considered the armpits. This will help to cool the internal temperature of the animal. Monitor the animal's temp by using a digital thermometer in the rectum. Normal temperatures for dogs and cats are 99.5 to 102.5 degrees Fahrenheit. And of course, get immediate veterinary care because this can be a very serious condition. Shock is a life-threatening condition that is a result of insufficient blood flow throughout the body. This generally occurs after a traumatic injury or a severe illness. It is important to know the signs of shock, which are a weak pulse, shallow breathing, nervousness, or dazed eyes. If your animal appears to be in shock, keep him restrained, warm, and quiet. You will want to keep the head level with the rest of the body and transport him immediately to the veterinarian or 24-hour emergency clinic. Okay, so yeah, unfortunately, our pets can choke. It's usually on something like a chew toy or something that they shouldn't be chewing on to begin with. I personally have a little dog at home that's always chewing on something she shouldn't be. It's bad news. So the signs of choking are difficulty breathing, excessive pawing at the mouth, coughing, and cyanosis. You'll want to carefully open the animal's mouth to try and see if there's a lodged object. Never stick your fingers in the mouth. You can try to carefully remove the object with a pair of tweezers or pliers, but you have to be sure that you don't accidentally lodge it farther down the throat. If the animal is like too frantic and you think that there's a chance that you could get bit trying to remove the object, then it's better off just not to do it because there's no sense in getting yourself injured and then two of you have to go to the hospital. If your pet isn't breathing, the first step is to open the airway. You can do this by gently grasping the tongue and pulling it forward and out of the mouth. This will allow you to get a better look to see if there is an object lodged in there. The next thing you'll want to do is do some rescue breathing. So you're going to need to close the mouth completely and then with your hands and then breathe with your mouth directly into the animal's nose until you can see the animal's chest rise. And then you're going to want to do this every 4 or 5 seconds. Now, if for some reason the animal has no heartbeat, then you're going to want to also do chest compressions. Only do this in the case of no heartbeat. You can verify if the heart is beating by checking for a femoral pulse, which is, in the groin area, you can use your fingers to feel the pulse. I found a video that the AVMA did on YouTube that actually shows a really good demonstration of doing chest compressions. I was going to play the video in here, but it's about 8 minutes long, and I didn't want to make this already lengthy presentation longer, so there's the link for it if you're interested in watching it. It's a pretty good little video. So the last thing that I want to talk about is traveling. It's great when we can bring our friends with us on vacation, but unfortunately emergencies can still happen then too. It's a good idea to pack a small travel first aid kit. This will be very similar to the at-home first aid kit, but you might also want to add extra medications that can alleviate car sickness. Talk to your veterinarian about what is a safe product to use. You're also going to want to have all the same phone numbers, but also make sure to find the name of a 24-hour, or the name and number of a 24-hour emergency clinic that is local to where you will be staying. Again, you don't want to have to scramble to do this if there is an actual emergency. You're also going to want to make sure you keep an ID tag on your pet at all times, just in case they should happen to get away. You might even want to have a travel ID tag with information on where you're staying while away from home so that you can be contacted while still in the area. Okay, so I just want to thank you for watching this little presentation, and I hope you found it helpful. If you have any questions, you could always leave a comment down below, and I'm going to be checking back. So if you do have any questions, I will try and answer them as soon as I can. Thank you so much.